Hi Martin, so you're the founder of Clarity Stress and Trauma. What does Clarity do?
Well, we help organisations look after the people for whom they're responsible when things go wrong, and we help them to prepare in case things go wrong.
Go wrong?
Yes, it might be that they recognise the pressure that their employees are under, possibly because of some kind of organisational change, for instance, and they want to provide them with information that will help them to protect their psychological welfare, their mental health, if you like. Or they might want to provide direct clinical support to a valued colleague who's having a particularly bad time.
So those are examples of stress management, aren't they? What about trauma response?
Yes, you're right. When people suffer traumatic events, they may have reactions which are both distressing and which interfere with their ability to just carry on with the normal routines of their life. Now, those reactions do overlap to some extent with the problems that people experience who are suffering stress due to the pressures and demands in their lives. But the services that are needed to respond to trauma are quite different.
So what's the main difference?
Well, the basic principles are to be prompt and proactive. So don't waste any time and don't wait until people ask for help.
So how can Clarity help its customers be prompt and proactive?
Well, really, there are three main things that they should consider.
Okay, so can you take us through them one at a time?
Yes, first is preparation. There needs to be a policy in place which firstly recognises the potential for a traumatic incident to occur, and secondly makes it clear who it is that has to make a decision about what to do. We can help organisations to design policies so that they protect the psychological welfare of their colleagues and their customers where that's relevant.
Okay, so that's the first lesson, have a well thought out policy. And what's next?
Well, second is training. Whilst it's a good idea to have somebody like a trauma consultant to come and look after people after an incident, it's not enough. It's vital that the organisation itself shows care and concern. We can train people so that they know what sort of thing to say and do, and just as importantly, what not to say and do.
Okay, and thirdly?
Well, thirdly is a joint response. If the worst happens, then the preparation and the training that I've just described will be invaluable. But it's usually necessary to have somebody, a specialist, come along and meet with the people who've been affected. Most people will find it very helpful to meet with a consultant whose role is really two things. Firstly, to help them discover that their reactions, however distressing and however destructive they might be, are actually the reactions of normal people, and they're not strange, odd or mad. But also the role of the consultant is to help people think about how they're going to manage those reactions so that they're able to get back to the normal routines of their life as soon as possible.
Great. So to summarise, a good reaction to a traumatic event requires preparation, training and a prompt response from both the organisation and Clarity. Is that right?
Absolutely right.